Ozempic, a medication originally developed for type 2 diabetes, is now at the center of a global conversation around weight loss, health equity, and pharmaceutical ethics. In this part of the video, we'll examine how it works in the body, the scientific evidence behind its weight loss potential, and the growing concerns surrounding its widespread use, including mental health effects, access challenges, and the shifting cultural meaning of body image.
Ozempic is a prescription medication used to help lower blood sugar in adults with type 2 diabetes and can also aid in weight loss. The medication is developed by the Danish pharmaceutical company Novo Nordisk and is still produced by the same company today. Its scientific name is Semaglutide, which refers to a synthetic version of a natural hormone that plays a key role in regulating blood sugar levels and controlling appetite. The history of Ozempic begins with research into a hormone called GLP-1, glucagon-like peptide 1, first identified in the 1980s, which was found to help regulate insulin and appetite. Novo Nordisk began developing semaglutide in the early 2000s, and after over a decade of research and clinical trials, Ozempic was approved for treatment of type 2 diabetes on December of 2017 by the US Food and Drug Administration. Ozempic has grown in popularity not only for diabetes management, but also for its ability to help people lose weight when combined with a balanced diet and increased physical activity. It's become a widely discussed part of modern healthcare, becoming the most talked about and one of the most important drugs of the whole world, reflecting a shift toward medications that support long-term lifestyle changes rather than just treating symptoms. What is the main purpose of Ozempic? And the answer is B. Diabetes type 2 management.
Ozempic is a type of medication known as a GLP-1 receptor agonist, that's short for glucagon-like peptide 1. GLP-1 is a naturally occurring hormone that plays a key role in regulating blood glucose and appetite in the body. When you eat, your intestines release GLP-1, which sends signals to multiple systems in the body. Ozempic mimics this hormone, but with enhanced potency and a much longer half-life, meaning it stays active in your system for about a full week. When blood sugar levels rise after a meal, Ozempic activates GLP-1 receptors on pancreatic beta cells, promoting them to release more insulin, but only when glucose levels are high. This helps lower blood sugar without causing hypoglycemia, which is a key advantage over older diabetes medication. It also inhibits the release of glucagon, a hormone that normally tells the liver to release stored glucose. With less glucagon circulating, the liver produces less glucose, keeping blood sugar levels more stable, especially between meals. Ozempic also slows the rate at which food leaves the stomach, a process known as gastric emptying. This leads to a longer lasting feeling of fullness, reduced hunger, and smaller food portions over time. This mechanism is one of the main drivers behind the weight loss effects of the drug. Perhaps most importantly for weight loss, Ozempic crosses the blood-brain barrier and activates GLP-1 receptors in the hypothalamus, a region of the brain responsible for regulating appetite and energy balance. This leads to a reduction in food cravings and overall caloric intake. Beyond just appetite, Ozempic has been shown to reduce inflammation, improve insulin sensitivity, and potentially lower cardiovascular risk factors in people with diabetes or obesity, though these effects are still being actively studied. So in short, Ozempic works on multiple levels: the pancreas, the digestive system, the brain, and the liver, creating a coordinated response that not only improves blood sugar control, but also significantly suppresses appetite and promotes weight loss.
What natural hormone is Ozempic based on? And the answer is C. GLP-1.
Ozempic, like any other drug, also has side effects. The most common side effects include nausea, vomiting, constipation and bloating, fatigue, and in some cases dizziness or dehydration. More serious but less common risks include pancreatitis, gallbladder complications, and a potential link to thyroid tumors, which has been observed in different animal studies but is not yet confirmed in humans. Mental health professionals are also raising concerns, stating that patients have reported a disconnection from hunger cues, emotional blunting, and disordered eating patterns. These psychological effects, while less visible, are crucial to evaluate, especially as Ozempic is increasingly becoming prescribed for cosmetic reasons rather than medical reasons. Ozempic's popularity has caused global supply shortages, making it harder for diabetic patients to access a medication that was specifically designed for them. From an economic standpoint, costs without insurances range from $900 to $1,200 per month. Insurance approval is inconsistent, especially when prescribed for weight loss. Physicians are reporting increased administrative burdens due to prior authorizations and off-label requests. Healthcare equity is being challenged as wealthier individuals can access Ozempic for aesthetic purposes, while lower income patients face barriers. These concerns have led many experts to question the sustainability and ethics of how this medication is being used.
What are the two common concerns about Ozempic? And the answer is D. It has side effects and can be expensive.
Now to move on to the cultural and ethical implications of Ozempic. Ozempic has become more than just a medical treatment. It's now a cultural symbol. It's shaping a new beauty standard, slim, medically enhanced, and often associated with wealth and discipline. Some even call it the Ozempic body, a shift from curves to a thinner, more subdued aesthetic. This raises real concerns. Are we prioritizing appearance over long-term health? Are we reinforcing harmful ideas that equate thinness with worth? And are we fully understanding the consequences for those taking it and for the healthcare system trying to keep up? In the end, Ozempic reflects both the power of medical science and the pressures of modern culture. How we use it and how we talk about it will shape not just individual outcomes, but our collective understanding of what health really means.
Ozempic represents a true medical advancement, but also a complex social moment. As with any powerful tool, its value depends on how it is used, who has access to it, and whether we approach it with nuance rather than hype. Not only is it crucial to understand the chemical impacts Ozempic has on our bodies, but it's also important to consider how this scientific development could become an influential trend that shapes us socially, ethically, and culturally in ways that may be both beneficial and challenging. Here comes the game. The first one to complete the crossword puzzle wins. And the answers are... Thank you for watching. For more evidence-based breakdowns on emerging health trends, subscribe to the channel and stay informed.